Welcome back to the Simplify Senior Transitions podcast, the show that brings you expert insights, real conversations, and actionable advice for families navigating the complex world of senior care, downsizing, and everything in between. I'm your host, Dale Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area. And like many of you, I'm part of the sandwich generation, juggling work, family, and figuring out how to support our aging parents. This podcast is here to simplify that journey and connect you with the resources you didn't even know existed. Today's episode is especially eye-opening. My guest is Laura Welsh, California Community Outreach Manager at Nuclear Care Partners, an organization that provides free in-home health care to former atomic workers who developed illnesses due to workplace exposures. You might be surprised to learn that many seniors who worked at facilities like Lawrence Livermore National Lab may qualify for powerful federal benefits, and yet many of them and their families don't even know it. If your loved one worked at a DOE facility, or you simply want to learn about this hidden program that supports some of our country's most overlooked heroes, this episode is a must listen. Let's dive in.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by Senior Transition Specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
And we're back, everybody. Laura, so glad for you to be on the show. How are you today?
I'm great, Dale. Thanks so much for having me today.
You're welcome. Well, what we're talking about is a very interesting topic because I really didn't know about it myself until earlier on this year. So I'm glad that you're here to talk about it, to spread the word. So can you share your background and what brought you to work with Nuclear Care Partners?
Sure. I've been in healthcare in some way, shape, or form for about 40 years.
Okay.
I was a trained and licensed EMT at the beginning of my career.
Okay.
I've worked for medical device companies. I've worked for DME companies. And I did 12 years as a hospice liaison. And then I found Nuclear Care Partners. And it kind of clicked. And I've been with them for almost 10 years. I have my 10-year anniversary coming up in July.
Oh, nice. Yeah, nice. And what drew you personally to this mission of serving former atomic workers?
There was a need locally, right? Lawrence Livermore Lab is just 20 minutes away from my house,
Right.
Sandia Lab. And all of these folks worked there in secret for the betterment of our nation.
Right.
And for their efforts, they got sick. And that really resonated with me because I like history. I love reading about the World War II and the Cold War. So this kind of meshed with my interests that way. And it was a way to develop a longer-term relationship with patients that I serve instead of in hospice. Sometimes your patient, you meet your patient, you get to know your patient, and then your patient dies within a week. I've been with the company for almost 10 years and still have really good relationships with everybody that we serve.
Love it. Now, what's your role as a California Community Outreach Manager, and what does a typical day look like?
I'm the marketing leader here in California, and I also cover Oregon.
Okay.
And the typical day is different every day. I get up at dark o'clock in the morning before the sun rises, and I do my morning things, emails, phone calls, and then the bulk of my day is spent out in the community, whether I'm marketing to different facilities or to doctor's offices or hospitals, or I might be having coffee with a community partner that I've met to get to know how we can work together, or some networking events. So that's the bulk of my week. And then the patients that I sign for the program, there's several of them throughout the week. And our goal always is to educate. whether it be the patient or the community at large. That's my whole job is education.
Perfect. And for those who don't know, what is the Energy Employees Occupational Illness Compensation Program Act? There's probably an acronym for that, but tell us more about that.
It's the EEOICPA, and it was an act of Congress that was established in the year 2000 and signed into law by the President of the United States at the time. And it established a $150,000 lump sum payout to folks who worked in the atomic weapons industry in the Department of Energy, who, through no fault of their own, got a radiogenic cancer or silicosis or beryllium disease from their work.
Okay.
And then 4 years later, in 2004, they realized just the radiation exposure was the tip of the iceberg.
Oh, wow.
And Congress acted a law, and the then president signed it into law that compensated folks to $250,000 more for exposure linked toxic chemical exposure linked illnesses like Parkinson's and anything that wasn't a cancer.
Got it. Now, who qualifies for these benefits? Can you give examples of the kinds of jobs or facilities that are covered?
The great thing is anybody who worked in the facility can potentially qualify. You usually have to work at least 1 year on site in the facility. And the facilities are either Department of Energy facilities or atomic weapons employers that's designed, built, tested components or actual bombs for the United States, starting from Lawrence Berkeley Lab to Oak Ridge during the Manhattan Project through the Cold War to now. Yeah, people sometimes are still getting sick. It wasn't just in the 60s, 70s, and 80s. And anybody from a janitor to a physicist or even a contractor, maybe they had laborers or carpenters coming in and doing work, as long as they were on site and can produce medical records that prove their illness, they can potentially be eligible.
Okay, now, what illnesses or exposures are typically linked to these claims?
Oh boy, everything and everything. Lots of internal bodily cancers, think from the brain to the bladder and everything in between. Here in California, I see a lot of blood cancers, so leukemias and lymphomas. See a lot of bladder cancers. I've been seeing an uptick of Parkinson's disease recently too. And luckily, the government has eased some of the guidelines as far as qualifying for Parkinson's. And what they typically used to do is say, no, you don't have any qualifications, but they've added some toxic chemicals to the mix, could potentially cause Parkinson's. So it's getting a little easier to qualify those folks. And those are the folks that really need our help.
What kind of compensation or support is available to qualifying workers?
So if they have a radiogenic cancer, a silicosis claim, or a beryllium disease, they get $150,000.
Okay.
Free. Got to mention tax-free. You don't have to report it on your taxes. If they have anything else is toxic chemical induced, or if they are really impaired by their illness, they get up to a variable amount, $250,000. And then they get free medical benefits for their covered conditions for the rest of their life. And that includes in-home health care. And that's what we do.
Got it. Now, funding, where does funding for all of this come from? Is it at the federal level?
It's a federal level and it's protected. So every time you hear that the Congress is worried about the budget passing and people are getting laid off and things like that, this is protected money. It's supposed to be protected money. It's already funded. So that money is there to help these folks. And there's been, I took a little statistic here.
Yeah.
To wit, total compensation just recently. It's $825 million.
Oh, wow.
No, I'm sorry.
Oh, wow.
Yeah, $825 million. And the medical bills paid are in the billions of dollars.
Okay.
So that money is free and clear of taxes, comes from the federal government, and it is an entitlement that people are entitled to because they gave their health for their
Yeah.
jobs and their country.
Here's a big question I have. Why do you think so many people still don't know about these benefits?
The unfortunate part about some of these diseases is the latency period, which means they take a long time to develop. So
Okay.
a person might have retired from one of the sites and they probably got a package from their HR saying, oh, by the way, you might have this available to you if you ever get sick. And then they threw it in a drawer somewhere. And the government doesn't do a real good job about following up and saying, hey, remember that thing? Are you sick yet? So 25 years later, they might develop an illness and kind of remember, but maybe they don't, or they've moved away. And there's no infrastructure to, like us, to give them education, in the community. So they just don't know.
Yeah.
But I blame it on the government.
Got it. You know what? You talked about the free in-home healthcare services, and I want to delve a little bit more into that.
Mhm.
So, what does the free in-home healthcare really mean for families on a day-to-day level? I mean, is it just a certain amount of hours a day? But if somebody needed 24-hour care, is that even provided?
It is.
Oh,
We provide nurses, so RNs or LVNs, or home health aides, CNAs, home health aides, or we can even pay a family caregiver who's already doing the job for activities of daily living. So we can provide a comprehensive care team that takes care of these folks. And the amount of hours that are given are determined by their illness that is covered by
yeah.
the Department of Labor and what the Department of Labor approves. So typically, usually in 4-hour segments, sometimes less, and all the way up to 24/7. We have quite a few folks 24/7. We have a couple folks 2 hours a day for a week. It varies. It really is tailored to the patient.
Okay, so now this clarifies a lot for me because at first I was thinking it was just non-medical caregivers, but it's more than that. This sounds like it's also home health.
It
Um,
it is, in fact, home health. It's the full spectrum of home
wow.
health, and we coordinate their durable medical equipment, oxygen. We have special clinical programs for special disease states. So we know a lot of folks have breathing issues that have worked at these places. So we developed a Breathe Better program where we can take their doctor's orders, give them exercises to strengthen their lungs, and we have evidence-based results we can
Okay.
share with folks that it really does work.
Okay. How do your nurses and caregivers coordinate with physicians or other providers?
The great thing about this program is the patient gets to choose his doctor.
Okay.
He or
Nice.
she can have whatever doctor he wants. So
Okay.
we coordinate directly with the physician's offices. If a patient doesn't have a doctor, I am sometimes out in the field trying to find a doctor for a patient because some of these folks are shut-ins and they might not have seen a doctor except for that one time in the ER where they found out they had cancer. So now they need a primary care and an oncologist. So I'll go find one for them.
I'm sure you have a lot of success stories, Laura.
Yeah.
Can you share a story where the support from nuclear care partners really made a difference in someone's quality of life?
Yeah. At the beginning of my career with Nuclear Care Partners, I had a patient who had a horrible blood disease, who had a bunch of transfusions and a bone marrow rescue. That caused him to have graft versus host disease, where the body rejects the new bone marrow, and he was in a dire strait. He was being fed through a line in his chest
Mm-hmm.
because he couldn't eat anymore. And we have, and we still have, the most wonderful nurse who came and nursed him. He was a 24-hour patient, so he had a couple of nurses, but this one nurse, she's a real go-getter, and
Hmm.
she was his nurse for a couple of years, and she reported back to me just last year that not only had he beaten his graft versus house, he still has a little bit, he was well enough to not have to have 24-hour care anymore, down to 2 hours of care and went back to work, which
Oh,
was astounding.
wow. That's
When I went
amazing.
to hospice, and when I first saw him, I thought, oh, okay, that's about
Yeah.
3 weeks. 3 weeks, and he's going to be gone. And she just did wonders with him.
Wow.
Yeah.
Now, I want to segue into talking about the claims and the enrollment process.
Mhm.
So, first question here is, what steps should a former worker or their family take to start the claims process?
Call me. Call me. Tiny
That easy.
family. There are resource centers, government resource centers throughout the country. I think there's 5 or 6 of them. But with the state of the government right now,
Yeah.
they are not manned 24 hours a day. They are not manned 8 hours a day. Sometimes they're manned by somebody at their house who just takes a phone call. So the best way to do it is give your care partners a call. We have a whole department
Okay.
coordinates with these government centers. We will collect the medical records. We'll help marshal through the process. If you want somebody to help you through the process, there are people called authorized representatives.
Uh-huh.
They're independent. They're not part of Deathly or Care Partners. But because we've worked with so many for so long, we can kind of figure out who might be the best fit for the person and assign that person to help the claimant. Authorized representatives get paid 2% of whatever monies the government gives the client for this program. If, for example, they get $100,000,
Yep.
they would get 2% of that, which is,
Right.
don't make me do the math,
Right.
$2,000, right? So the best thing though is if they don't qualify for the program and their claim is denied, they don't have to pay anybody anything.
Okay.
So
Yeah, that's cool.
totally on a contingency, and it's written into law so that these representatives cannot charge more than that.
How hard is it to prove eligibility? What kinds of documents or history do they need?
For cancers, a pathology report is the best document. For other illnesses like Parkinson's, the original diagnosis and the physician's narrative are the best documents. And then for some of the other ancillary illnesses, it depends on what the illness is. But a doctor has to diagnose the patient. And the Department of Labor wants to know what the original diagnosis date is, because sometimes there's a contingency in the program that a person has to have worked a year or 5 years from the time of exposure in order to qualify. And a lot of folks that I talk to, they still don't believe this program is real.
Yeah.
They think it's all a scam. Or they think that, oh, I wasn't exposed to anything, even though there are toxins all over the sites. There's
Right.
radiation, gosh knows wherever. And I say, don't leave that to chance.
Right.
Give me the benefit of the doubt. Give the government, as it is, the benefit of the doubt. You might qualify just for being there.
Yeah.
You know? We have people who used to work in offices. Had a set of folks worked in the same office. They were not next to any plutonium or radiation experiments. But what they didn't know is a scientist had put some radioactive material in the cubicle behind them and kind of left it there for a while. And all of these ladies got the same kind of weird breast cancer.
Oh, wow.
So you never know.
Right.
I get it all the time. I don't qualify. I was never exposed. It's like, did you go into work one day? You were exposed, whether you knew it or not.
Now, how long does it usually take for someone to go from applying to receiving care?
Applying for the initial benefit, that's one process. So it depends on the illness that they have. The government has certain guidelines. If, say, for example, they worked at Livermore Lab and they had a radiogenic internal body cancer like a lung cancer, as long as they worked at least a year and they worked prior to 1989, it'll take about 2 months. Very quick. That's very quick government time. If it's outside of those dates, it may take up to a year because there's a whole nother department that looks at what their exposures were. They look at records, they interview the clients, and then they make a determination. But that shouldn't put anybody off either, because the threshold for approval is a 50% causation. 50% meaning it's at least as likely than not caused by their exposure. And then once they get approved, they get a little white medical card, like an insurance card, and that opens the door to any sort of medical care for that condition, including home health care. And that process can take, if they're terminally emergent, it can be right away, or sometimes it takes up to a couple of months to get care, because the Department of Labor, we have to gather records, we have to get a letter of medical necessity, we have to ask the Department of Labor for a certain number of hours for that client.
Okay, got it. Now, many listeners and viewers of this podcast are in the Bay Area. Out of curiosity, how many former workers from Lawrence Livermore Lab might be eligible?
Tens of thousands.
No kidding. Wow.
One lab. That's just one lab. So let's say Lawrence Livermore in Zambia. Let's say 10,000 people. There are over 380 sites throughout the U.S.
Okay.
Either designed, built, tested, whatever, atomic weapons. So, and people, move around when they move around. So somebody who lives here that maybe worked up in Washington State, that's another 10,000 or whatever. Yeah, there's a lot of people.
So on a related note then, I know there's obviously other nuclear facilities. Can you only help folks that work at nuclear facilities in California? Or I think you also said you help out in Oregon too.
Oh, yeah. I can help anybody throughout the United States.
Okay, throughout. All right.
There's several sites in California. So Lawrence Berkeley Lab, Livermore Lab, Sandia. GE Ballecitos is an atomic weapons employer for a certain time. Stanford Linear Accelerator. And then down in Southern California, there's several sites. Santa Susana, General Atomics. Santa Susana is the site of the nation's first nuclear meltdown that nobody knows about.
Interesting.
Yeah.
Now, what are the most common challenges you see families facing here locally?
As far as getting approved, or?
Yeah, it's just as far as getting approved. Let's talk about that.
So getting approved, we're talking about coming up on real elderly people that don't have the memory of what they might have done, or maybe they have dementia on top of their covered conditions, so they can't answer what they think they might have been exposed to. So we're kind of reliant on the government to have good records of that. So that's a big challenge. Sometimes doctors are a barrier. Sometimes doctors equate this home health care with the Medicare model, and it really isn't. We're a chronic illness model. So we can take care of folks for the rest of their life as long as they warrant it. Medicare, you take care of them for a couple of weeks and then you're done. So because Medicare, you always have to show progress in the illness. We know that a lot of these illnesses are not going to better. They're going to get worse. Therefore, we take care of them until they die.
Yeah. Now, I know you're out in the field a lot, and I wanted to ask this question. Do you partner with other professionals like fiduciaries, senior care advocates, placement agents, and even realtors like myself?
Absolutely. And I do a lot of outreach events where I invite community partners to speak. I just had an outreach event last month that drew 100 people. I had a
Nice.
luncheon and I had a couple of community partners there. And the nice thing about this benefit, because it's paid for by the Department of Labor, we can also partner when it's warranted with hospice care and other home health care getting paid by a different payer source. So that really gives the patient, an enriching environments to have care in, because sometimes hospice comes and goes, maybe an hour a day.
Yeah.
Maybe we're approved for 10 hours a day.
Yeah.
And we can really help take care of them and keep an eye on their hospice team.
Yeah. Very nice. What advice would you give to someone who thinks their parent might qualify but isn't sure?
If you're not sure, or even if you are sure, call me.
Okay.
I'm the expert in this area, and I can usually tell just by a face sheet sometimes
Yeah.
what you might qualify for. Even if you have a mom or a dad that's saying, "Oh, I'm not going to qualify for anything," just go to the coffee shop and give me a call, and I'll meet you there, and we can talk about it. I don't charge anything
Okay.
to anybody. I do not cost a dime to talk to you, or to help marshal through the paperwork. I'll go
Mhm.
pull paperwork if you mean. I can usually tell what they'll qualify for.
And how should families start this conversation with their aging loved one? Any recommendations?
My dad died when I was 17, and what I regret is not talking about his time in the service.
Hmm.
These men and women worked at a special time in our country, a time where things were happening that had never happened before. They were working on novel, new things.
Right.
And don't wait until they've passed or that they've gone a little demented before you start getting curious about what mom and dad did. They might surprise you. Maybe they worked at Area 51, which is a site that's covered. Maybe you'll find an alien. I don't know. But these men and women did things, and they were proud of the job that they were doing. They knew it was secret, and they
Right.
kept those secrets for so long. Give them an outlet. Let them tell you what they did. It's all declassified now. Some people still keep the secret, but I'm sure they'd love to tell you about what they did.
Yeah. On a related note, what are some signs that it's time to explore these benefits, even if the parent hasn't brought it up yet?
As soon as they have that diagnosis,
Okay.
a diagnosis of a cancer, a diagnosis of a serious chronic disease like lung disease or kidney disease or Parkinson's disease, don't wait. Call me right away.
Yeah. Going back to what you said earlier, Ron, some people think that the services you provide are too good to be true. They're not real. How does your team build trust with families that may be skeptical about it all or overwhelmed?
Everybody has my phone number. They can always call me. We have a full care team from the regional vice president of nursing down to the clinical director that they can call on. Our founder was a nurse, or is a
Okay.
he's still a nurse. She and her co-founder were nurses that just wanted to give jobs to 10 people to see if they could do this company when they started it. They wanted to give jobs to 10 people and they wanted to help 10 patients. And that was success to them. They would go out and give baths themselves. And I think the founder still would. She's just the sweetest and most loving thing. She's very um, instrumental in Washington, getting
Okay.
some of the laws passed for these men and women. We call them heroes because they were. Um, it's not a scam. It's a government program that's directly related to folks who help save our country.
Okay. And I want to wrap into some closing questions with you.
Sure.
What's the most rewarding part of this work for you personally?
I love hearing the stories. I can
Yeah.
sit and talk to a patient for hours sometimes because I'm just fascinated. And a lot of these men and women have saved scrapbooks. And just looking at history and hearing about the history of the Cold War is fascinating to me. And when folks appreciate you, and my patients, when I see them, they greet me with a big smile and a hug. And the best thing is they don't die within a week. I can keep meeting them, sharing a cup of coffee with them for a long time. We can help them get better.
Yeah. Now, what do you want more families to understand about these hidden benefits?
They're absolutely free. The monetary part is tax-free. The
Okay.
only thing that you might have to pay for is if you hired an authorized person to help you with the paperwork or the payment. And even that is a pittance. It's
Yeah.
sometimes life-changing money for some of these folks.
Yeah, I understand. And how can someone get in touch with you or learn more about Nuclear Care Partners?
Our website is www.nuclearcarepartners.com. My direct phone number is 209-597-0887. Our office hours, that phone number will find me because my phone follows me like a bad habit. So if you call me on the weekend, chances are 95% chance that I will pick up. Then my email is lwelsh, that's LWELSH at nuclearcarepartners.com.
Got it. Where are you guys based out of curiosity?
Rancho, Colorado is where the corporate office is, and I'm over here in Livermore, Tri-Valley area.
Got it. Do you have a physical office in the Bay Area?
Not anymore. During the pandemic, we thought it cost effective to shut the office down because nobody could come in and congregate anymore. And I'm just as efficient in my home office than I am in a physical office. And I'm always ready to meet somebody at a third party, like a coffee shop or a library, or in the patient's home.
Perfect. Last question. Any final thoughts or encouragement for families who are navigating this path?
You don't have to do it alone. I can be there every step of the way. And even if you're unsure, just give me a call. It's no pressure. I don't do a hard sell. And hopefully I can help you when you need it.
Perfect. Laura, thank you so much for being here today. What you and your team are doing is incredibly important. And for many families, this conversation may be the first time they're hearing about these benefits. You're not just delivering care, you're delivering justice and peace of mind. And for those of you watching or listening, if your loved one is considering senior living and you need to figure out what to do with their home, let's talk. Schedule a free consultation with me by clicking the Calendly link in the video description box below. Learn more about my services at www.simplifyseniortransitions.com. Have a quick question? DM me on Instagram at SoldByDale. And if you found this episode helpful, please leave a 5-star review on Apple Podcasts or Spotify. It helps more families discover the show. And don't forget to share this episode with someone who might need it. Thanks for tuning in. And one last thank you, Laura, for being on the show with me today.
Thank you so much, Dale. It's been a pleasure.
You're welcome. And for everyone else, I'll see you next time on the Simplify Senior Transitions podcast.